see my colleague from Armenia too. I'm sending my greetings with pain in heart. I was following your presentation, looking at the pictures. It's never acceptable that civilians, children are target of our target. It's not acceptable. War or battle should happen in battlefield. And so heartbreaking to see that civilians, especially children, are killed from both sides. So I will, we are talking, Mira probably would agree that right now shellings are happening and people are losing their lives, including military people, including soldiers, including civilians and children. So let me see if I can. So I was asked to prepare a presentation about policies and services for victims in Azerbaijan. So I am Aytakin Huseynli and representing here today Azerbaijan Social Work Public Union. Myself right now in the United States. Why I am presenting Azerbaijan from United States? First, because I'm in the board, and secondly, people in Azerbaijan are board members and colleagues in Azerbaijan, they don't have sustainable internet because of we don't have a country, we don't have right now access to proper internet because of the security issues. So in this case, I myself thought that it will be good to kind of participate and see what we can all do together to have a peace in our region. We need to have peace in the region. We need to have same kind of conditions like in European Union, in North America, where the people cross the border and they don't know, well, they just suddenly they realize that they are in different country. So as a social workers, we Azerbaijani social workers, we believe in this. We want to all of us to work together to have this kind of conditions in our region as well. As you know, South Caucasus region is full of conflicts and wars, I would say, but it can't continue forever. We need to work towards that to have peace in the region. So at the end, I will tell as a social workers what our role to do that. But before that, I wanted to go through what we have as a social protection for people in Azerbaijan who are affected by war, including military people, soldiers, and civilians. Okay, so this is like, as you see from the pictures, like, as I said, it's happening. And like just yesterday or before the yesterday, shelling happened in cities far away from battlefield, and about so far 90 civilians died, about 400 people wounded, over 2,000 houses and 92 buildings destroyed, about 400 civil facilities are damaged. This is happening in the war which started 27. So there are statistics from the war which is happening right now. It is huge burden for a country to have this kind of loss, in terms of human loss, in terms of infrastructure, in terms of houses. It's a burden to country which is not developed, which is not very well set. But since 1988, Azerbaijan has about 300,000 refugees from Armenia and 700,000 internally displaced people from Nagorno-Karabakh and 7 regions surrounding it. So since 1988, about 20,000 people died, about 50,000 people disabled. This is also very, again, like why I'm telling the statistics, the war brings a huge burden to economy, to social development of the country. The people died, they were mainly head of the households, and people who are disabled, they lost their productivity as well, which governments need to support them. And it's a huge economic cost for any society, including Azerbaijan. So as you know a little bit, like Nagorno-Karabakh is one piece of the territory, and also there are 7 regions surrounding it, which is about 700,000 people are displaced from their homes, and they are currently mostly living in abandoned buildings, in dormitories of universities. Azerbaijan also, although trying to give them a temporary, decent housing, but it's very hard to cover this many people with decent housing. So although we have some public policies, I will go through them and then talk about them. It's also like just recently happened in Ganja, a residential area was bombed, about 20 people died and over 40 wounded. So what we have in Azerbaijan, we have couple, I will start talking about the state level measures, like government measures, and also civil society and private people. So we have special committee, which is called State Committee on Refugees and IDP Issues, to especially deal with the social economic issues of this group. So we, as I mentioned, there is first policy right now, one of the big policies is sheltering stable housing for IDPs. Out of 700,000, only 100,000 people are placed in buildings and houses by settlements. They are called IDP settlements. So IDP is internally displaced people. I will be using this word. For IDP people, this is special focus for housing policy, special focus for IDP, focused on for IDP people. Refugees from Armenia, which they started coming 1987, they were deported so from Armenia before Nagorno-Karabakh war started. I would say they're almost integrated in the society. I wouldn't say they fully integrated, but they kind of settled a little bit, but they still also, there's no housing policy specifically for refugees. So this housing policy is focusing on the IDP people. So about 600,000 people are still living in trains, abandoned trains, in libraries, in dorms, in hospitals, in theaters, all this kind of public housing mostly, which doesn't have very good condition for people or for raising children or whatever. Second policy in Azerbaijan, we have about the cash assistance for IDPs. So cash assistance, IDP people receive certain amount per month because they lost their properties, they lost their asset, they lost their working ability maybe, or like working place. That's why they need government's assistance. So this is the guy who lost his children and children and wife overnight in Ganja. So another state program and services we have from the government, which is regulated by the State Committee on Refugees and IDPs, as you see, is provision of communal services such as gas, water, electricity. It is provided by the government for free for IDP people. Another measure is free medical services for diagnosis and treatment, especially focused on IDP people. So IDP people has a privilege to use this service. Then there is another measure is covering medicines approved from the list of medicines approved by the Ministry of Health. Then school supplies for children in IDP from IDP families are provided. Although books are free in our secondary schools, our book supplies are not free, but IDP children has a privilege, probably IDP second generation already because children 30 years grown up. Second, IDP grandchildren would say are eligible for these supplies. We also have scholarships in colleges and universities for people who identify themselves IDPs. So we have paid and unpaid universities, public universities, or private universities. So IDP community are free of this charge, free of the payment, tuition payment. So we also have couple waivers as a government's support service for IDP people, such as when you receive your national ID card, when you are in court, when you're in notarial services for purchasing houses, properties, you don't pay any money. So in Azerbaijan, it is a little bit there are social protection measures, services and policies, but it's not under one umbrella. Another ministry, another government agency which provides social protection assistance to people affected by war, it is Ministry of Labor and Social Protection of Population. And this category of people are not IDPs, but military people who serve in the military, soldiers, and also martyrs, or like families of the military soldiers who died. So what they get as like also veterans, right? Also veterans. So we have this IDP committee, we call it IDP Refugee Committee for specific IDP and refugees. And then another group such as soldiers, veterans, and their families, or martyrs, we call them, who lost their lives in battlefields. For them, Ministry of Labor and Social Protection is taken care of. And again, the same kind set of the services, and you can see cash assistance, one-time cash assistance, free provision of housing of families of military people who died, free provision of families of martyrs. So we have different categories, and for each of them is separately focused measures, free provision of housing for veterans, monthly pensions for veterans, monthly pensions for families of martyrs. So there are a couple, as you see, couple cash measures. Then we have another ministry, which is called Ministry of Emergency Situations. What Ministry of Emergency Situations provide, especially recently, not only military people, but also civilians, mental health services for people affected by recent rocket attacks. And it is focused on civilians only, as far as I know. So when rocket attack happens, they go to find the people and start working with them. Okay, this is all government measures and services policies we have from the government for people who are affected by war. And then we have civil society programs and services. One of the biggest one is Azerbaijan Red Crescent Society. They have been in Azerbaijan for a long time. It's very institutionalized government NGO, and they're almost all part of the country. But what they do, mostly they do material aid, like humanitarian aid, when people are affected by a rocket or in the battlefield houses, mostly civilians. They go and provide material aid, what I mean, food, blankets, medical assistance, and they also have a little bit of mental health services, not that much. Right now, civil society, like a lot of private donation campaigns are going on right now, and a lot of cash assistance, clothing and supplies for civilians who are affected by war, and also for people, soldiers and military people. So this is what we have as a government civil society measures. But social work is a very new profession in Azerbaijan. So I would like to talk a little bit about the role of the social workers. Social work is a very recent profession in Azerbaijan. It started in 2005. As Anna mentioned, I am one of the first trained professional social workers, which with my other colleagues, we established the first social work education program. Then profession started working on the profession itself. And it is in social work, it's in infancy. It is developing, trying to find its niche in the society. But like in Israel, like in Ireland maybe, or other countries, we don't have a specific social work type, like military social work or social work in emergencies, to work specifically with people affected by the war. But right now, so random social workers, they are working with civilians, especially with civilians. They are in the field, they're trying to find out their immediate needs and connect them with resources, help them. But there's a huge potential to have a social worker working in this situation in Azerbaijan. We have, although it's a new profession, we have about 9 universities to train social workers, about 700 trained social workers by national programs so far, and over 100 by international programs. So we have this human capacity, human resource of social workers who can be trained and work with this sort of people affected by the war, with everyone, with families of military personnel, soldiers, martyrs, and civilians. I hope we will not need this kind of social work for a long time in our society. It is just for a short time, for rehabilitation time. So I also would like to mention a couple words what social workers need to do. In South Caucasus, most importantly, social workers, different from our other maybe countries in Europe, since we're talking about the social work in Europe, first should promote human diversity while working with trying to help all this group which I mentioned with their social, economic, and mental health issues. Human diversity, tolerance to each other, and accepting, respecting all nations or all ethnic groups around us, and like training and raising a new generation that we as a human being, we need to learn to live together. We need to respect each other. We need to have tolerance to each other's ideas, to each other's backgrounds, that we can have sustainable peace in the region. Meanwhile, I would also like to mention that there is a huge gap in Azerbaijan. I don't know if it is the same in Armenia or not, that we don't have much mental health services for people affected by war. A lot of people so far is living with PTSD. And a lot of PTSD is post-traumatic stress disorder. As right now, it's also very much needed. Although government person, like government clerks or high position government people mentioned it a couple of times in front of international agencies, that not only provide material aid to IDPs and refugees, but also mental health services. So far, there is no institutionalized, there is no nationwide mental health services, although I have to mention that a lot of psychologists right now and a lot of organizations are helping individually people affected by the war, especially civilians. But there is no, like this, as you see among the services and policies, the mental health services are not taking that much place, which is needed as other services. So this is one of the big areas in the region. I think we all as a social workers should focus and kind of push our societies to create mental health services, to recover from PTSD, to recover from the loss of the family. A lot of new evidence-based techniques such as EMDR, such as somatic therapies, such as grief therapies, which is highly demanded right now in Azerbaijan, because I recently heard a lot of the suicide cases from the people who lost their husbands, who lost their sons. They couldn't cope with the stress, they couldn't cope with the grief. So as a region, I think, and we would like also our international community, international colleagues who are listening to us, I can say on behalf of Azerbaijan, we need your help in establishing mental health services for people are affected by the war, and also previous generation of veterans and families. So this is what I have to say. I was going to say thank you very much again for your attention, and happy to answer questions.